Hi, I have major depressive disorder. And I know that there are many channels on YouTube that already carry this type of information. But I felt like me sharing my story could help someone else. And so I decided why not. First, I'd like to start with a brief life history of mine. When I was a child, I was an introvert, extreme introvert, just liked to do my own things, was very quiet. When I was in high school, I had a panic attack, didn't know what it meant, but I remember one day I had my hands on my chest and was basically just hyperventilating, and someone saw me, one of the other students saw me, grabbed me, just threw me on their back and ran to the clinic. So that was my first experience with that. And then when I was in college, that's when things really, really started to get more intense for me, where I would miss tests, exams. I would basically stand up and just like pass out, like just lose the wind, no air. What I mean, I also had anemia. I also had anemia, but I remember when I went to the clinic, they kept saying, just breathe, breathe. And I kept thinking, well, I'm already breathing. I don't know how else to breathe. But I had anemia and I was panicking. I had panic attacks. Maybe that's normal, maybe that's not, but it kept happening and it just kept happening and happening and happening. Once I graduated college, but during college, while I was in college, I had three jobs, just to be able to like afford going to school and housing and everything like that. My working years, I loved working, especially after I graduated from college. I loved working. I loved just being able to just do work. You work. I had my day job. On my way from work, I would always, do extra tutoring or things like that. So my life was basically work. I worked and I worked, and I enjoyed the value in working. I did transition about maybe 13 years ago. I transitioned from a job working at a lab to a job working at the hospital. When I was working at the hospital, I was working an hour, I was traveling an hour and a half to work. And on my way back, my 1.5 hour drive back, I already booked jobs for tutoring and would go to people's homes and tutor. And by the time I got home, all I had was enough time to basically just go to bed because my job there started at 4 in the morning and I needed to be on the road by 2:30. So 8 p.m., 9 p.m., I needed to be in bed. Again, I was fine. And then I took up a teaching job, which I was also very excited about. I was the first at the building before the building was open, and I was the last. Like the security literally had to kick me out of the building. I loved the work. I loved the job. I was told many times by the director that I was doing a good job. But that was the job where things got worse, where I started having really bad depression. I don't know if it was being around chemicals in the lab where I was teaching, but something there was where I started with a sinus infection or sinus inflammation that just wouldn't go away. And I just took a ton of medications for it and took, until I started having other symptoms and had to take prednisone and things like that. And for allergy, I had to take all these other medications, which I think were downers. I don't know. But since then, I've had issues. I've had issues that just, being able to get up, getting motivated, and things like that. And to elaborate on that, I'm basically going to give some examples of things that I experienced. I would basically be excited about something, maybe something that I bought at the store or bought that's supposed to come from Amazon. And when it gets to my apartment, I would lose like I would see the box and like not open it for 6 months. So, or I would be thirsty and like be almost, I feel like I'm catatonic and like not even get up and get a cup of water. Like that level of feeling down. Just, and like I said, just the motivation. Things that used to excite me were not exciting me. I would forget things. I lost concentration. Of course, I found out, well, when I started therapy, that I also had ADHD, which, concentration, how you study, things like that. But yeah, I just felt like I was a waste. I truly felt like that. I would basically sometimes just wonder why, I'm in this beautiful apartment where it could be someone who is more productive that was in it, or wish I was in a different planet because, everyone's moving around and moving at like good speed, and I'm dragging. I would be with students and not be able to focus on anything. I'll be looking at the homework and just can't focus, and just a lot of weird things where it's like, okay, I'm trying my best, I'm here to do the work, I'm here to do something, but then all of a sudden I'm weak, I can't focus, I'm not motivated. I'm supposed to motivate students, but I can't if I myself am not, I don't have the motivation to give, so I'm just sitting here like a dead person. And so it's very frustrating, again, like I said, because I used to be very motivated and, create PowerPoints with videos and all these things and animations and things like that. And now it's just like, I, it's not like I don't feel like it. I can't describe it, but the motivation, the drive to do that, especially because I'm also tired all the time and exhausted all the time and things like that. As of today, I'm on medication, and the medication that I'm on doesn't fix everything. It doesn't make everything perfect, but it at least gets me up from bed. When I say get up from bed, people who don't know what depression is or ever had depression, I'm not saying being depressed, but having depression, they just think you don't feel like getting up from the bed. That's not what it is. It's if you've experienced it, then you know it. So yeah, sometimes I just the getting out of the bed, but me, since taking the medication, that's been something that's better. Where I'm having issues sometimes still is motivation. And so just getting motivated, I like when I really like to do something, I'm motivated. I can go days without like chatting with people. Like I would just be on it and just focused and just do what I need to do. So I love that. I love that about my true self. When I don't have depression, when I'm fine. And that itself is another source of depression, because when you know who you are or who you used to be and there's nothing you can do to get back. It, I have people telling me, "Oh, just make yourself smile. All those pictures, you had sad eyes." Well, I didn't make my eyes sad. I didn't go eyes go become sad right now. It's just how things are when you're going through that stage. So some days are better than others, and that's it. One of the things I wanted to use this time for is first to speak with people who may have depression like I do, as well as people who, are relatives or family members or friends of someone who has depression. I'll start with people who have depression. Okay. So first of all, I would like to speak to people who also have depression. I'm not a professional or anything, but from what I've read and what I've been told by professionals, the best advice is basically to go see a mental health specialist. A lot of people that your friends, your family, they don't know how this works. They don't understand it, and that itself could be very frustrating, and it just it adds another layer to what you're going through. So this is one where the best bet is to go and talk to someone, and they even have online therapy sessions that you can go to. If you can go to a physical one where they can see you and talk to you and assess you better, I think that's the best bet. While you're going through this, just know that when you talk to some people who do not understand what you're going through, they they don't understand the symptoms, which I'm going to pull up right now. Depression, also called major depressive disorder or clinical depression, is a common but serious mood disorder. It causes severe symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. This is where I think people don't understand. It affects how you think, it affects how you handle day to day activities. You're not the same person that you used to be. If if this is like a new diagnosis, maybe you're not working fast enough and you're not moving fast enough. And we're in this world that's fast and everything's moving, and so sometimes it could, for some people, they feel like you're dragging them down, you're complaining again and things like that. For that, I say get better support. There are very supportive people in this world, and there are people who are just not supportive. And sometimes even your own family members aren't the best people to help you with this. I watched a YouTube channel about depression a few years ago, and I remember the girl talking about how the only person who checked on her after she had told everyone, including her parents, about depression, the only person who checked on her was not even a member of her family. So again, it's because people don't understand. It doesn't mean that they're evil or anything, but do what's best for you. If you need to reach out to friends that can help you, then you should. I hear this saying, oh, family's forever, friends are just for a time. Okay, fine. If your friend is only for that time that you had a crisis and they're able to get you through it, I think maybe take advantage of that moment where you have that friend who can get you through it until your family catches up and understands what this is. But a good support system is something that I believe is very helpful. And in my case, I think friends, sometimes even strangers, have been a better help just because those strangers happen to understand more and they were able to give me better advice and just make me feel better at a time when I was going through a rough time. If you have family that's extremely supportive, please share with them and let them know that way you're not suffering in silence. I'm going to continue with depression, what it is. So, to be diagnosed with depression, the symptom must be present for at least 2 weeks. If you have been experiencing some of the following signs and symptoms most of the day, nearly every day, for at least 2 weeks, you may be suffering from depression. Persistent sad, anxious, or empty mood, feelings of hopelessness or pessimism, feelings of irritability, frustration, or restlessness, feelings of guilt, worthlessness, or helplessness, loss of interest or pleasure in hobbies and activities, decreased energy, fatigue, and feeling slowed down, difficulty concentrating, remembering, or making decisions, difficulty sleeping early morning, awakening, or oversleeping, changes in appetite or unplanned weight changes, thoughts of death or suicide attempts, aches or pains, headaches, cramps, or digestive problems, without a clear physical cause that do not ease even with treatment, suicide attempts, or thoughts of death. Major depression includes symptoms of depression most of the time for at least 2 weeks that typically interfere with one's ability to work, sleep, study, and eat. There are other types of depression, but today I'm just going to stick with the major depressive disorder, major depression. Yeah, so depression is different from one person to another. Depression is not just, oh my God, I was sad yesterday. When people tell you that, it's because they don't understand. They want to try to help you. They don't know the right thing to say, and they're saying that, which is the reason why it is recommended to go talk to the people who actually understand this and can help you. There are many people who lead wonderful, successful lives with this. There are actresses who are funny and, on TV. And they have moments when they're not acting when they're going through major depressive disorders. So this can happen to anyone, and you can still live a good life if you have people who can help you. The negative sides and some of the things that I've experienced, one I even experienced yesterday, which basically prompted me to make this video and start a YouTube channel. I was talking to someone yesterday, my younger brother, and he started going into how, wisdom and how he's so wise and he's praying for me to have wisdom. This was someone who was a baby when I rocked him to bed. Like he's much, much, much younger than me. And then he went into the Bible talks about the value in hard work. I have depression. I know how to work. I've been working since it was in fifth grade, like working three jobs. And so to me, I feel like that was insulting. The whole thing about I should be praying for wisdom, not guidance, but wisdom, like to be wise. And also, how, the Bible says there's something in hard work. I'm having a tough time. I don't really need someone else to basically pile up on it. And so what I've decided to do is to protect my own peace, and I just know when not to pick up that person's phone call from now on. Not that I'm going to neglect them or anything, but I have to that really did bother me a lot. And that's what you need to figure out is who's triggering your depression, who's making things worse. This whole idea that you just need to talk to your family even if they're hurting you, I don't think that's the right thing to always do when you have something like this. There are many people who commit suicide on this, with this because you used to be a wonderful person and great, and like now you have this thing and you're not the same person that you used to be, even with treatment. So find people, find support groups. I think, go to an institution where they can help you. Okay. To the family members of people who have major depressive disorder, I'm gonna give you a few scenarios. When you have a relative who becomes suddenly blind and don't know what to do, people rally around and try to figure out what they can do to help. Basically, they can't see, and so they need you, who has eyes, to guide them when they need to walk to places, when they need to go on stage where there's stairs and everything like that. Yeah, people whose legs aren't working and they are in a wheelchair, they need people who have legs, whose legs are functional, that can wheel them from place to place. Depression is no different. With depression, what that person lacks are chemicals, or they have an imbalance in serotonin and dopamine. And so, what they need is someone who has serotonin and dopamine that can motivate them to do stuff. It may mean that you have to be more creative, it may mean that you have to be more patient to motivate them and say, hey, I know it feels horrible right now. Why don't you walk with me? Let's go take a walk down the street, and maybe that would help you. That's what that person needs. What someone who has depression does not need is someone yelling at them, judging them, telling them they're stupid, they don't know the value in work. Especially when you know that before they had this, they were a hard worker who, touched many lives and did a lot of things. So, I think at that point it becomes, what do you do? Do you yell at them so you can vent and feel better? Or do you figure out what it is that helps the other person? What is it that they're missing? What is it that they need help with? And try to see how you can plug yourself in. If you're not a patient person and can't do it, maybe encourage someone else who is patient and can basically help. Again, one more time, I'm going to talk to people who have depression. You're special. You're wonderful. Don't let anybody tell you that you're not wonderful and that you're not special and that you're a waste or anything like that, because none of that is true. There are many actors, musicians, you know, who are making it and they have major depressive disorder. They just have a good support system that can help them get through it. And they have a good treatment plan, and there are people who watch out for them and just know what to look out for when something goes wrong. And, comment down below if you need, if you want to chat, if you want to talk, if you want to have any discussion and things like that. Thank you for listening.